So I think the barriers are interesting. Certainly one of them is going to be access. So there's a lot being done to improve access to minorities. So there's a whole demographic out there about multiple myeloma in African Americans. And when you slice through all of the data, perhaps the biggest barrier to good outcome is access to clinical care. And so within the myeloma community, there's a large effort to see if we can erase that, make things readily available to everyone. So with multiple myeloma, we're actually in a unique era. Before we used to just stage patients and sort of determine the treatment based on stage. Now it's considerably more complicated with that. And we're starting and continuing to do risk stratification. And there's a lot of debate amongst who is high risk and who is not. And then I think in this day and age, we're very fortunate in that we have a lot of agents to pick from. And we have a lot of frail elderly myeloma patients where you can now sort of design a very nice regimen that'll be effective and well tolerated. So I think the barriers are really the racial minority barrier, and then also finding stuff that we can treat elderly infirm patients with, because myeloma is still a disease of the elderly.